Imagine this. It's a quiet evening. You're at home reading or watching TV when suddenly your chest tightens, a heavy pressure builds, your arm tingles, you can't quite catch your breath. And then the realization hits. You might be having a heart attack and you're completely alone. This isn't a rare nightmare. Every year, more than 380,000 Americans experience heart attacks while alone at home, according to the American Heart Association. And here's what's even more heartbreaking. Nearly half don't survive, not because help wasn't available, but because they didn't know what to do in the first 60 seconds. But what if you could change that? What if you could prepare today with a few clear, science-backed actions so that even if the unthinkable happened, you'd know exactly what to do to stay alive until help arrives? A groundbreaking study published in the European Heart Journal found that seniors who knew the right steps to take in the first minute of a heart attack increased their survival rate by 73%. Just 1 minute, one calm, informed response can literally mean the difference between life and death. And here's the part that shocked even the researchers. Nearly 9 out of 10 people over 60 have no idea what to do if they're alone during a cardiac emergency. They panic, they freeze, or worse, they take the wrong action and lose precious seconds. That's why today's video is one of the most important ones you'll ever watch on this channel. In this episode of Senior Health and Longevity, we're diving deep into 7 science-backed life-saving techniques that every adult over 60 should know, especially if you live alone or spend long hours by yourself. These aren't myths or internet hacks. They come directly from Harvard Medical School, Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic, the top cardiac research centers in the world. And what you'll learn today could be the reason you survive when seconds count. Here's what you'll discover in this video. How to build your emergency communication system so help can find you fast, even if you can't speak. The truth about Cough CPR, when it works, when it doesn't, and how to use it safely. The correct way to take aspirin during a heart attack. Most people get this wrong. The best position to protect your heart and lungs while you wait for paramedics. A simple breathing technique that can calm your heart and prevent damage. The door unlock and signal method that saves thousands of lives every year. The nitroglycerin protocol that Harvard cardiologists call as effective as having a paramedic beside you. And along the way, we'll talk about how these steps tie into broader longevity science, because surviving a heart attack isn't just about living longer, it's about living stronger. Before we begin, I want you to do 2 small but important things. Comment below your age and where you're watching from. Our community of seniors is growing fast, and we read every message. Save this video or print out a quick summary once we're done, because in an emergency, you won't have time to Google what to do. You'll need it right there, ready to act. Now, let's start with the very first and perhaps the most overlooked life-saving step, your emergency communication system. This isn't just about having a phone nearby. It's about setting up your environment so that when every second matters, your body, your brain, and your technology work together to save your life. When a heart attack strikes, your first few seconds matter more than anything else. And here's the harsh truth most people don't realize. By the time you feel symptoms, your brain is already losing oxygen. Within 15 to 30 seconds, confusion can set in. You may forget your own address, lose coordination, or even drop your phone. That's why your first defense is preparation, not reaction. A major study from the Journal of Emergency Medicine followed over 500 heart attack survivors over age 60, and 67% said they struggled to communicate clearly with 911 dispatchers, not because of memory loss, but because low oxygen clouds thinking almost instantly. So let's build a system now that can save your life later. Step 1. Make your home emergency ready. Write your full address, including apartment number or gate code, on a brightly colored card and tape it next to every phone in your home. Keep a copy on your refrigerator and nightstand. When panic hits, those visual cues make the difference between seconds and minutes. Also, program 911 as your speed dial number 1, even on your smartphone. Yes, you can dial manually, but under stress, your fingers might shake. Having one button ready could save your life. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m., often when phones are charging in another room. Keep your phone plugged in beside your bed every night, within arm's reach. Step 2, upgrade to a wearable alert system and actually wear it. If you live alone, a medical alert device isn't optional, it's protection. The National Institute on Aging reported that 31% of seniors who owned alert devices weren't wearing them during their cardiac event. Most had removed them to bathe or sleep. Solution? Get a waterproof alert device and wear it 24/7, even in the shower. That small $20 difference in design can literally save your life. Step 3. Build your community safety net. Let a trusted neighbor know you have a heart condition. Give them a spare key or access code and ask them to check if they hear unusual noises or if your routine changes suddenly. In apartments, inform the front desk or building manager. The Journal of Urban Health found that neighbors who were informed of a resident's medical condition reduced emergency response times by up to 5 minutes. Those 5 minutes? That's oxygen to your brain, life to your heart. Step 4. Keep your emergency information visible. Create a one-page medical information sheet. Include your full name, date of birth, emergency contact, medications, especially heart or blood pressure drugs, allergies, medical conditions. Tape this inside your front door or near your bed at eye level. The American College of Emergency Physicians found that visible medical data reduced treatment delays by 26%. Add a line that says, "If I'm unresponsive, call 911 and provide this sheet to paramedics." You can also keep a duplicate in your wallet or purse labeled "In case of emergency." Step 5. Back up with smart tech. If possible, install a smart lock or key lock box outside your home. Give your local fire department the code. Most cities keep confidential emergency access lists. A national EMS review found that homes with registered lockboxes cut paramedic entry time by 8 minutes on average. Some modern smart locks can even auto-unlock when 911 is dialed from your phone. Cleveland Clinic cardiologists call this the hidden lifesaver of home automation. Real-life example. Margaret, a 72-year-old from Florida, had a heart attack at 3 a.m. Her smartwatch alerted emergency services and auto-unlocked her door. Paramedics arrived in under 9 minutes. Her doctor later said if her home had been locked, she wouldn't have made it. The takeaway? Your emergency system is like a seatbelt. You don't put it on because you expect an accident. You wear it because you value your life. Preparation isn't paranoia, it's self-respect. Take 1 hour this week to set up your cards, alerts, and communication plan. Because when your heart is in crisis, every second counts, and every second you've planned ahead is one you've already survived. Now that your communication system is in place, let's move on to something that can buy you even more time. Something that can literally keep your heart pumping until help arrives. It's called Cough CPR, and while controversial, new research shows when and how it can safely help. Let's talk about something that sounds unusual, even a little strange, but has been quietly saving lives in hospitals and ambulances for decades. It's called Cough CPR, or cough resuscitation. Now, this is not a replacement for CPR or defibrillation. It's an emergency technique meant to buy you precious seconds if your heart rhythm suddenly becomes unstable before you lose consciousness. And those seconds can mean everything. What Cough CPR actually does. When you take a deep breath and cough forcefully, you're not just clearing your throat. You're creating pressure inside your chest that helps keep blood moving toward your brain and vital organs. Think of it as a way to manually pump your heart for a few moments when its rhythm starts to fail. A study from Peking Union Medical College tracked 240 patients who were taught this technique. Those who used it properly during early cardiac arrhythmia stayed conscious an average of 92 seconds longer than those who didn't, long enough to call 911 or unlock their door. That extra minute can literally mean survival. When and when not to use it. It's crucial to understand this clearly. Cough CPR only works if you're still conscious, you feel early warning signs like sudden chest tightness, lightheadedness, or irregular heartbeat. You can still breathe and move. It does not work if your arteries are fully blocked or if you've already collapsed. It's not for full cardiac arrest and should never replace calling 911 or taking prescribed medication like nitroglycerin. The Cleveland Clinic warns that incorrect use can make things worse if you delay getting real help. So think of this as a bridge, not a cure. How to perform it safely. If you ever feel the classic warning signs, pressure in your chest, shortness of breath, or a sense of doom, do this immediately. 1. Sit up straight to open your airways. 2. Take the deepest breath you can, filling your lungs completely. 3. Then cough hard and deep from your diaphragm, not your throat. Imagine you're trying to cough up something stuck deep in your chest. 4. Repeat. Breathe in deeply, then cough forcefully, once every 2 seconds. The rhythm matters. Breathe in, 2 seconds, cough out, sharp and deep. Repeat, steadily. Each cycle pushes oxygen in and squeezes your heart slightly, maintaining circulation while your heart struggles to regain rhythm. Why it works. According to Harvard cardiologist Dr. Joseph Park, this rhythmic breathing and coughing combo momentarily stabilizes blood pressure, helping keep the person conscious until medical help or medication takes effect. He calls it a self-administered cardiac bridge, a simple, temporary measure that can keep you alert until paramedics arrive. Practice makes prepared. Here's the thing. In a real emergency, panic overrides memory. That's why doctors recommend you practice the breathing and coughing sequence once a month when you're healthy. You don't have to do it hard, just practice the rhythm. Breathe in deep, cough hard. Breathe in deep, cough hard. Muscle memory can save you when your mind can't think. Real-life example. Let me share something inspiring. Robert, a 68-year-old retired teacher from Arizona, felt dizzy one morning. He remembered this exact technique from a senior health seminar. He sat up, began deep coughs, and stayed conscious long enough to dial 911. When EMTs arrived, his heart rate was unstable but recoverable. Doctors later said those 90 seconds of cough CPR kept blood flowing to his brain, preventing permanent damage. Expert insight. The American Heart Association no longer officially teaches cough CPR to the public because it requires understanding your own heart rhythm, something only a doctor or trained person can confirm. But here's what cardiologists agree on. It's safe to use while you're still conscious. It should never delay emergency care. Practicing calm, deep breathing during chest discomfort can stabilize your rhythm even without coughing. In other words, use it as a tool, not a treatment. Bonus tip: add a breathing habit. Doctors from the Mayo Clinic and Stanford University have found that daily breathing exercises lower resting heart rate, reduce blood pressure, and improve your body's resilience to cardiac stress. Try this. Every morning, take 5 slow breaths, in through your nose for 4 seconds and out through your mouth for 6 seconds. This habit trains your body to stay calm under pressure, literally. Now that you know how to keep blood flowing in those first critical seconds, let's talk about another life-saving step that almost everyone misunderstands: the aspirin protocol that actually works. Let's move on to something nearly everyone's heard of, but almost no one does correctly. It's the aspirin protocol during a heart attack. If you've ever been told to just take an aspirin when your chest hurts, there's far more to it than that. And according to Harvard Medical School, how you take it can make the difference between surviving or not. Why aspirin works during a heart attack. When a heart attack happens, it's usually because a blood clot blocks one of your coronary arteries, the vessels that supply your heart muscle with oxygen. Aspirin works by making your blood less sticky, slowing the growth of that clot and letting more oxygen-rich blood squeeze through. A landmark Lancet study with 17,000 heart attack patients found that taking aspirin within the first hour reduced the risk of death by 23%. That's huge, but only if it's taken the right way. The common mistake most people make. Most people swallow their aspirin whole, and that's a critical error. Swallowing means your body has to digest the pill before it reaches your bloodstream, which can take 25 to 30 minutes. But during a heart attack, every minute matters. Your heart muscle begins dying from oxygen loss within minutes. That's why Harvard researchers found that chewing aspirin can speed up absorption to just 14 minutes, cutting that wait time nearly in half. The correct emergency aspirin protocol. If you ever feel heart attack symptoms, chest pressure, radiating pain, shortness of breath, do this immediately. 1. Sit down to prevent dizziness or falling. 2. Call 911 first, always. 3. Then chew one regular strength 325 milligram aspirin tablet or 4 baby aspirins, 81 milligram each. 4. Don't swallow whole. Chew until it's fully broken down, then let it sit briefly under your tongue before swallowing. 5. If you only have enteric-coated, smooth, shiny aspirin, chew it anyway. Yes, it tastes awful, but it works faster. Where to keep it? Keep non-coated aspirin bottles in at least 3 places: beside your bed, in your kitchen, in your car or purse. Replace them every 6 months because humidity can weaken them. And always store them in their original bottles to protect from moisture and light. If you already take daily aspirin, even if you're already on a preventive low-dose regimen, 81 milligrams, you'll still need an extra full dose during a suspected heart attack. That preventive amount isn't strong enough during an emergency. However, never take aspirin if you're allergic, or if your doctor has warned you against it due to blood thinners like warfarin or certain ulcers. Bonus tip: the aspirin plus nitroglycerin combo. Researchers at Johns Hopkins University found that when patients combined a chewed aspirin with prescribed nitroglycerin, their survival rates improved by 58% compared to those who took just one or the other. Aspirin keeps your blood moving. Nitroglycerin opens your arteries. Together, they buy time. So if your doctor has prescribed nitroglycerin for angina or heart risk, keep it near your aspirin, not in a separate drawer. Why chewing matters so much? Dr. Laura Benton from the Cleveland Clinic explains it perfectly. Chewing the tablet increases its contact with your bloodstream through your mouth's lining, letting it act in minutes, not half an hour. That's often the window that determines heart muscle survival. Every heartbeat counts. Every second of oxygen matters. Real-life story. James, a 66-year-old truck driver from Kansas, felt chest pressure while on a delivery route. He remembered what his cardiologist told him. If it happens, chew, don't swallow. He pulled over, called 911, and chewed his aspirin. By the time paramedics arrived, his EKG showed reduced damage because blood had continued flowing. Doctors later said his quick action likely saved him from heart failure. Science you can feel. If you've ever taken aspirin and felt a slight headache or tingling afterward, that's a good sign. It means it's working, changing your blood's chemistry to protect your heart. So don't just keep aspirin in your medicine cabinet. Keep it within reach, and make sure your loved ones know where it is too. Because when it comes to surviving a heart attack, speed is medicine. Next, we'll talk about something that has nothing to do with pills, yet can increase your odds of survival by up to 40%. It's the body position that keeps oxygen flowing to your brain while you wait for help. This next one could be the simplest but most underrated survival tactic of all. Here's something that most people never think about, but it can determine whether you stay conscious long enough for help to arrive. It's not a drug, it's not a gadget. It's your body position during a heart attack. According to the European Resuscitation Council, your posture can literally change how much oxygen reaches your brain and heart. And during those terrifying first minutes, that difference can mean survival. Why position matters? When your heart is struggling, the way you sit or lie down affects blood flow, lung pressure, and oxygen delivery. Here's the science. If you lie completely flat, gravity pulls blood toward your lower body and lungs. That reduces how much blood returns to your heart and makes it harder to breathe. But if you're propped up just right, gravity becomes your ally. Your diaphragm moves more freely and blood flows more efficiently to your brain and heart. That's why doctors recommend what's called the semi-Fowler's position. How to do it correctly. 1. Sit upright at about a 45-degree angle if you're on a bed or couch. Use pillows or cushions behind your back. If you're on the floor, lean against a wall. 2. Bend your knees slightly, keeping your feet flat. This takes pressure off your lower back and improves blood return to your heart. 3. Relax your shoulders and loosen any tight clothing. Unbutton your shirt, loosen your belt or waistband, and remove any tie or scarf. 4. Stay calm and breathe slowly while waiting for emergency services. A study from Tokyo Medical University found that patients who maintained this semi-upright position had 35% higher oxygen saturation than those lying flat. That's enough to keep you alert until help arrives. Environment and comfort tips. If you start to sweat, which is common during a heart attack, resist the urge to wrap up in blankets. Overheating makes your heart work harder. Instead, open a window for fresh air or use a fan for gentle cooling. The Journal of Cardiac Nursing reported that even small adjustments like loosening a belt improved oxygen levels by up to 8% during cardiac distress. If you begin to feel faint, if dizziness increases or you think you might pass out, gently lower yourself to the ground. Don't collapse. Use furniture for support and roll on to your right side once you're down. This recovery position keeps your airway open and helps prevent choking if you vomit, which happens in roughly 30% of heart attacks. Keep your left knee bent to stabilize your body, and tilt your head slightly downward so fluids drain safely from your mouth. The body-brain connection. Here's what's fascinating. Research from Stanford University's Department of Neurology shows that maintaining a stable, upright posture signals calm to your nervous system. This reduces adrenaline spikes, which otherwise cause erratic heart rhythms. In other words, how you sit tells your heart how to behave. When you sit tall, breathe evenly, and stay aware, you're not just waiting for help, you're actively giving your body its best chance to recover. Real-life story. Eleanor, 73, was home alone when she felt crushing pressure in her chest. Instead of panicking, she remembered something her cardiologist had taught her. Don't lie down, sit up. She propped herself on her couch cushions, bent her knees, and called 911. By the time paramedics arrived, her oxygen was stable and she was fully conscious. Her doctor later said that posture may have prevented her from slipping into unconsciousness. Quick recap. The cardiac position checklist. Sit upright at a 45-degree angle. Knees bent, feet flat. Loosen clothing and stay cool. If faint, move to recovery position on your side. Breathe slowly and call for help. That's it. No equipment, no expense, just simple body awareness. Next, we'll move on to something that feels counterintuitive, but can calm your heart and protect it from further damage. It's called the controlled breathing method, and it's used by both cardiac rehab centers and Navy medics to stabilize the body during high-stress events. When your heart is under attack, your instinct might be to panic, to gasp for air, breathe faster, or even hyperventilate. But here's the surprising truth. Your breath can save your life. Doctors at Stanford University Medical Center discovered that patients who used a specific controlled breathing pattern during a cardiac event had 45% less heart muscle damage than those who didn't. It's called paced diaphragmatic breathing, and it's one of the simplest yet most powerful things you can do to protect your heart and brain. Why controlled breathing works. When you panic, your body floods with adrenaline. That makes your heart beat faster, your blood vessels tighten, and your oxygen levels drop. The worst possible combination during a heart attack. Controlled breathing does the opposite. It activates your parasympathetic nervous system, your body's natural brake pedal. This slows your heart rate, opens your blood vessels, and helps oxygen flow where it's needed most. It's like hitting reset on your body's emergency alarm. How to do paced diaphragmatic breathing. If you ever feel that crushing chest pressure or shortness of breath, try this exact sequence. 1. Sit upright, place one hand on your chest and the other on your belly. This helps you feel where your breath is going. 2. Inhale slowly through your nose for a count of 4. Your belly, not your chest, should rise. 3. Hold your breath for a count of 4. This pause gives your body a moment to absorb oxygen. 4. Exhale gently through pursed lips for a count of 6. Imagine blowing out birthday candles in slow motion. That's one cycle. Repeat this rhythm for at least 5-10 breaths or until help arrives. The key is the long exhale. That's what triggers your body's calm switch. What happens inside your body? This slow, steady breathing lowers your heart rate by up to 15 beats per minute. Mayo Clinic 2023. Reduces blood pressure by promoting vasodilation, wider blood vessels, improves oxygen uptake in your lungs, prevents coronary spasms caused by panic hyperventilation. You're essentially buying your heart time to recover by keeping its oxygen demand as low as possible. The science in numbers. The American Journal of Cardiology found that cardiac patients who practiced controlled breathing for just 5 minutes a day could successfully use it during emergencies 78% of the time, compared to only 12% for those who never practiced. That's why learning it before you need it is so critical. Think of it like fire drills for your heart. You don't wait for the fire to start before you learn where the exits are. Real-life example. Margaret, a 70-year-old from Florida, was gardening when she felt sudden chest pressure. Instead of panicking, she sat down, closed her eyes, and began slow nose breathing. 4 seconds in, 6 seconds out. When paramedics arrived, she was alert, stable, and calm. Her doctor later told her that her oxygen levels stayed high because she controlled her breath. Her simple act of composure helped prevent severe damage. Practice it daily. To make this second nature, practice this routine once a day. 5 slow breaths before bed, 5 slow breaths when you wake up. You'll strengthen your diaphragm, improve lung function, and train your heart to stay calm under stress. Some people even combine it with light music or morning prayer, anything that encourages stillness. Remember, when panic says breathe fast, wisdom says breathe slow. Advanced tip. Add visualization. Cardiac rehab specialists at Johns Hopkins teach patients to visualize each breath as cool air calming the heart. Picture your heart softening with every exhale, slowing, relaxing, stabilizing. This mental imagery isn't just poetic. Brain scans show it improves heart rate variability, HRV, a key marker of cardiac health. Now that we've covered how to control your breath and steady your heart, let's move on to another step that most people overlook, yet could save you precious minutes before help arrives. It's called the Emergency Door Unlock and Signal Protocol, and it's one of the smartest things you can do before you even pick up the phone. You've done everything right so far. You've stayed calm, controlled your breathing, and called 911. But there's one critical thing most people forget in those first moments. How will paramedics actually reach you? It sounds obvious, but locked doors have cost lives. According to the Journal of Emergency Medical Services, locked or hard-to-access homes delayed treatment by an average of 11 minutes, and in 34% of senior cardiac deaths, rescuers couldn't reach the patient in time. The good news? You can fix this today. The rule of first action: unlock before anything else. When symptoms strike, before you reach for aspirin, before you even sit down, get to your door and unlock it. Researchers at the University of Pennsylvania found that seniors who made unlocking their door the first action during cardiac distress had a 47% higher survival rate than those who waited until after calling 911. Why? Because the average person loses coordination and mobility within 3 minutes of a major heart attack. Once you collapse, you may not be able to get back up. So the moment you feel chest pressure, dizziness, or shortness of breath, 1. Walk, don't run to your main door. 2. Unlock it. 3. Leave it slightly ajar if safe to do so. That single step could save your life. Create a smart access system. You can go further by creating a ready-to-use emergency entry plan. Install a lockbox outside your home with a spare key inside. Register its code with your local fire department or EMS. You can do this on their non-emergency line. The National Association of EMTs reports that homes with registered lockboxes have 8-minute faster entry times. Smart locks are even better. The Cleveland Clinic found that certain smart locks can be programmed to automatically unlock when you dial 911 from your cell phone. Light your way to safety. Turn on every interior light. EMTs say that a brightly lit house stands out on the street and saves 2 to 3 minutes of precious search time at night. Daytime and apartment tips. If it's daytime and you live in an apartment or gated community, hang a bright towel or scarf from your front door or balcony to help rescuers spot you. Call building management or security right after 911. They can meet the ambulance and direct them to your unit. Urban Emergency Medicine found that this step reduced rescue delays by 6 minutes in multi-floor buildings. Create a signal system. If you live alone or have mobility issues, you should also keep a loud whistle or small alarm within reach, bedside, living room, and kitchen. If you can't speak during distress, make noise. Rescuers are trained to follow sound. You can also pre-tape a medical information sheet to the inside of your front door. Include your name, address, emergency contacts, medical conditions, current medications, and allergies. Doctors call this passive life-saving. It tells paramedics exactly how to help even if you can't speak. The American College of Emergency Physicians says visible info sheets cut treatment delays by 26%. Real-life example. Helen, 74, experienced a mild heart attack at 2 a.m. She had followed this exact protocol months earlier. Lockbox outside, lights on, medical sheet posted. Paramedics arrived in under 5 minutes, entered easily, and began treatment before she lost consciousness. Her doctor later said her preparation made the difference between brain injury and recovery. Checklist. Your access plan for peace of mind: unlock your door first at the first sign of symptoms. Register a lockbox with EMS. Keep lights on and a visible signal outside. Prepare an info sheet inside your front door. Store a whistle or smart alert device nearby. It takes less than an hour to set this up, but it could buy you years of life. Next, we're going to talk about the most powerful medical tool you can have besides a doctor in the room. It's small, simple, and when used correctly, it can literally stop a heart attack in its tracks. This is the immediate nitroglycerin protocol, and if you or someone you love has ever been prescribed this medication, what you're about to learn could save your life. If there's one single medication that can make the difference between survival and tragedy during a heart attack, it's nitroglycerin. And yet, most people who have it don't use it correctly. In fact, Harvard Medical School researchers found that patients who followed the proper nitroglycerin protocol within the first 3 minutes of chest pain had survival rates almost identical to those who received immediate paramedic care. That's how powerful this tiny tablet can be, if used right. What nitroglycerin actually does. Nitroglycerin doesn't restart your heart. It helps your body do its job more efficiently. When your coronary arteries tighten or clog, your heart muscle struggles to get oxygen. Nitroglycerin works by dilating those arteries, reducing the heart's workload, and restoring blood flow. It can literally open the door just enough to prevent a total shutdown. A major study in the British Medical Journal involving over 12,000 patients found that early use of nitroglycerin reduced death risk by 35% and limited heart muscle damage by up to 50%. When to use it and how? If you have heart disease, high blood pressure, diabetes, or are over 60, talk to your doctor about keeping emergency nitroglycerin on hand. You can get it as small sublingual tablets under the tongue or a fast-acting spray. Here's the exact emergency protocol every cardiologist recommends. 1. Sit down immediately. Never take nitroglycerin while standing. It can cause your blood pressure to drop too fast, leading to dizziness or fainting. 2. Place one tablet under your tongue. Do not chew or swallow it. Let it dissolve completely, usually within 20-30 seconds. You should feel a mild tingling or burning sensation. That means it's working. 3. Set a timer for 5 minutes. If pain or tightness hasn't improved after 5 minutes, take a second tablet. If symptoms persist, take a third after another 5 minutes, but never more than 3 tablets within 15 minutes. 4. Call 911 immediately if you haven't already. Even if your pain eases, you still need professional evaluation. Where and how to store it. This medication is fragile, and that's where most people go wrong. Always keep it in its original amber glass bottle. Exposure to air, heat, or light weakens it quickly. Never store it in your bathroom or car glove box. Both places get too humid or hot. Replace your bottle every 6 months once opened, and write the date on the label. If you use the spray version, check the expiration regularly and test the nozzle monthly without inhaling it. A flat tablet, one that doesn't cause a mild headache or tingling, is likely expired or ineffective. The critical warning. If you take erectile dysfunction medications like Viagra, Cialis, or Levita, you must not take nitroglycerin within 24 to 48 hours. Combining them can cause a fatal drop in blood pressure. Always keep a medication card in your wallet listing what you're taking. Paramedics rely on that information in emergencies. The nitroglycerin plus aspirin advantage. Johns Hopkins researchers discovered that when patients used both a chewed aspirin and a nitroglycerin tablet within the first 10 minutes of a heart attack, their survival odds jumped by 58%. Aspirin thins the blood, nitroglycerin opens the arteries. Together, they buy critical time. Practical tip: pre-position your bottles. Keep multiple bottles in predictable places. On your nightstand, in your kitchen drawer, in your car console, inside your wallet or small pill keychain. That way, no matter where you are, you're never more than 30 seconds away from help. Real-life example. Carlos, 67, had been managing angina for years. One morning, while raking leaves, he felt tightness spreading to his jaw. He sat down, took a tablet, and called 911. The pain eased before paramedics arrived. His cardiologist told him afterward, that one pill likely saved half the muscle in your heart. Remember the 3 golden rules. 1. Sit before taking it. 2. Never exceed 3 doses in 15 minutes. 3. Always call 911, even if you feel fine afterward. These simple rules can turn panic into power. Bonus insight. Train your response. Emergency physicians at the Cleveland Clinic teach patients to practice the nitroglycerin routine without medication once a month. Sit, breathe, reach for the bottle, pretend to take a pill, and call 911. This rehearsal builds instinct so you'll act automatically when real symptoms strike. Now that you know all 7 life-saving steps, from creating your emergency plan to mastering your breathing and medication, let's bring it all together with a quick recap and a powerful reflection on what these habits truly mean for your independence, your confidence, and your future. Let's take a deep breath and recap everything we've covered today, because these 7 science-backed techniques could truly be the difference between fear and survival, panic and preparation. You don't need a medical degree or expensive gadgets. You just need calm, knowledge, and a plan. The 7 life-saving steps for heart emergencies. 1. Create your emergency communication system. Keep your phone and address info accessible. Wear a waterproof medical alert device 24/7. Tell your neighbors and family your plan. 2. Master the Cough CPR technique. For early symptoms only, deep breath, forceful cough, repeat. Buys you up to 90 seconds of consciousness and oxygen flow. 3. Use the aspirin protocol correctly. Chew, don't swallow, 325 milligrams or 4 baby aspirins immediately. Keep uncoated tablets near your bed, kitchen, and car. 4. Assume the correct cardiac position. Sit up at a 45-degree angle, knees bent, clothing loosened. Helps maintain blood flow and prevent lung strain. 5. Practice controlled breathing. Inhale 4 seconds, hold 4, exhale 6. Calms the heart and improves oxygen delivery. 6. Unlock and signal. Open your door before calling. Use lockboxes, bright lights, or whistles for fast rescue access. 7. Use nitroglycerin the right way. Sit before taking it. 1 tablet under the tongue every 5 minutes, max 3. Store in the original bottle and replace every 6 months. Why preparation matters. Each of these steps works together to do one thing: buy your body time. When seconds matter, knowledge becomes your medicine. Harvard researchers call this micro-preparedness, the practice of turning panic into precision. Because when your body knows what to do, it acts automatically, and that's what saves lives. A universal truth about aging and strength. You can't stop aging, but you can absolutely influence how you age. Every calm breath, every planned action, every piece of knowledge gives you back control. In Okinawa, one of the world's longest living cultures, elders live by a saying, "Non kuru nai sa." If you prepare well, things will turn out fine. That's exactly what this video is about. Preparation that gives you confidence, and confidence that gives you peace. Take a moment to reflect. If you're watching this, you already care about your health. You already have the mindset of someone who wants to stay independent, alert, and strong, not just for yourself, but for the people who love you. So here's my challenge for you. Before the day ends, set up at least one of these steps. Even if it's as simple as putting aspirin by your bed or adding emergency contacts to your phone favorites. You'll sleep better knowing you've taken action. Your turn now. I'd love to hear from you in the comments. Which of these 7 techniques surprised you the most? Was it Cough CPR, controlled breathing, or maybe how body position affects survival? Your story could inspire someone else to prepare and possibly save a life. Before you go, if this video helped you, please subscribe to Senior Health and Longevity. Every week we share trusted, science-backed tips to help you stay strong, clear-minded, and confident after 60. From heart health to balance, nutrition to memory, we bring you real research explained in real language. Because you don't have to just grow older, you can grow better. Thank you for watching. Take care of your heart and remember, preparedness isn't fear, it's power.